Hey everybody, this is Dr. Brian Wussel with the Chiropractic Society of Wisconsin. I have the honor and the pleasure of speaking with one of chiropractic's legends. He will be a speaker at this year's Fall Summit, October 18th through the 20th in Wisconsin Dells. It'll be at the Wilderness Resort this year. Dr. Jim Cox, you have done everything. Private practice for over 50 years. You were the 1963 valedictorian of your class. Fellowships and honorary fellowships, diplomates, and developer of a technique, and I guess above all for me, the consummate student, always learning, always researching, and just finding out what the latest, greatest. And I'm so happy and excited to have you come to Wisconsin to join us. Doc, talk to us about what you're going to be talking about. What can docs expect to take away and use come Monday morning?
Improved clinical outcomes. That's the essence of why I'm coming. Chiropractic at this time is the leader in performing spinal manipulation. However, there are many other professions such as osteopathy and physical therapy, and yes, even allopathy, who want what we have developed. In order to maintain the primary thrust in spinal manipulation, we must study the biomechanics, the clinical outcome studies, and the causes of back pain. Now, to that end, we now know what goes on in the human spine by federally funded studies when we perform distraction spinal manipulation. That is, what are the changes in the intervertebral disc, the facet joint, the size of the osteoligamentous foraminal area, the ranges of motion, and the afferentation of the somatosensory cortex by functional MRI. We will explain what actually happens in the human spine when a chiropractor delivers spinal manipulation. We will then show you comparison studies done at Loyola and the Hines VA Hospital between chiropractic manipulation and physical therapy. Which one exceeds the other in giving good clinical outcomes? We will then study the cervical spine, the same biomechanical changes that happen with spinal manipulation. What are the treatments of spinal stenosis? And as you know, spinal stenosis is the 1 out of 4 conditions that occupies 95% of the cost in treating spine pain today. We will emphasize that at your seminar. We'll show the clinical outcomes of treating intervertebral disc herniation, spinal stenosis, certainly things like synovial cyst, subacute degeneration of the spinal cord, which all chiropractors are seeing, but what we must define as to the diagnostic and the clinical outcomes of performing chiropractic manipulation. And then, Monday morning, my goal is that this chiropractor in your audience goes back to their practice, utilizes these techniques to improve the ultimate, their patient's clinical outcome.
Doc, sounds fantastic. I'm excited to have you. It's been a long time since you've made your way to Wisconsin, and I am looking forward to having you back in the state, and we're in for a treat. So again, the Fall Summit, October 18th through the 20th, this year, 2019, in the Dells, the Wilderness Resort. Keep your eyes open for registration. And Doc, thank you very much for your time. I look forward to seeing you in October.
Thank you, Brian.